Right. Hello, everyone. I know folks will be trickling in over time. There were several folks that had conflicts. So we'll just manage that as it goes. Ebony, I'm going to make you a co-host in case anybody comes in. You can admit them in from the waiting room. Okay.
Okay.
Great. Hi, Trish. How are you?
I'm good, thanks.
Good. I like that sweater. It's my favorite time of the year weather-wise. Okay. So today we don't really have a packed agenda. There's no like formal slide presentation, which I'm sure all of you are excited to hear. I just want to highlight a few things. First of all, the assessment is out and it's in the community. I don't know if you have ready access to how many people may have opened it or how many people we sent it to, Patty. But while she looks that up, I'll just sort of provide a couple of things here. Number one is that we testified before City Council last week. Thank you, Dave, for helping coordinate that. I think it went pretty well. We got some good questions from the council members, but for the most part, it seemed to have been favorably received. I think, the one thing that we want to stress and what I want to highlight for this group here today is that there's going to be a need in an ongoing way to have this conversation around the implications of the assessment and the action plan. We hope that the advisory group can be the foundation for that work. So regardless of the particular contract that Community Solutions has, or even specifically, what the advisory group's role is in this project, longer term, we're imagining that there's going to need to be some sort of roundtable involved with many of you to digest and understand and implement the action plan and contemplate what the assessment means in terms of promoting health and wellness in the city of Lakewood and in all of its forms. So I want you to keep that in the back of your mind as we finish out this project for the remainder of the year, that we don't want this to just sit on a shelf, that our hope and our expectation is that all of you and other members of the advisory committee and other community members can come together in a regular fashion to talk about how to execute on this work. So keep that in mind. We also had a Cleveland.com article published. I included it in the email I sent out earlier today. Also pretty favorable. I think for the most part, the assessment report itself is getting out there in the community. It's being well received, and now it's about the action plan work. I don't know, were you able to pull up some of those numbers?
No, nothing is coming up for me, so I'll have to dig in a little bit.
Okay. So we'll pull out some numbers for you about how many people have opened and taken a look at the assessment. But we were able to send it out to our listserv of people who have signed up. So a lot of positive momentum. So with that, we want to get into the action plan conversation. And I know we've talked about it a few times over the last couple of months about the prioritization process. How do we go about doing that? But I have some key discussion points that the steering committee is asking all of you to weigh in on relative to the prioritization matrix. And so I want to discuss that and see if we can't refine the tool before finalizing. Before we get into that though, some high level things. Number one, the prioritization matrix is a way for you all and the steering committee to evaluate ideas that come from the community to address some of the issues that we saw from the assessment. Those ideas we're calling interventions, basically different things that we could try to do to improve the community's standing when it comes to health and wellness, social determinants, and that sort of thing. So it's a scoring tool. Everyone will get a chance to use that scoring tool to evaluate interventions. In the next month, I'm going to send out a survey so that you have a way to influence how that scoring tool is going to work. I will describe what that means in a concrete way so you can see what happens when you change some of the levers in that scoring tool. For now, the action plan is going to involve charrettes in the community. Basically, we're going to have an online way for the community to offer their intervention ideas. And there's going to be an in-person event that we have scheduled for October 27th at 6 p.m. to 9 p.m. at Cove Community Center. So people will be able to access the charrette and influence the interventions in both an in-person and a virtual fashion. You will see both of those come with instructions. It will be staffed, and we'll collect all the interventions from the community. And then your job essentially will be to use the prioritization matrix, right? The prioritization tool to rank order what ideas you feel should be picked up by the city, by the advisory committee moving forward, by philanthropy partners, et cetera, so that you can start executing on that work. Okay, so again, you'll see a survey come out, you'll need to fill that out. We'll have the charrettes where people will offer interventions. Then in November, you'll score those interventions. Then in December, we will finalize the process, and the action plan will be a report that rank orders those ideas by the categories we saw in the assessment. Okay? So let's talk about what this looks like.
Send you numbers, we haven't gone to.
Oh, great.
Yeah, so it was 155,
Go ahead. Yeah, well, real quick before we have some of the numbers on
yeah,
the
so, Ebony found them just at the same time I did. We had 164 people on the list of that, 155 were successful deliveries. 100 people opened the email, which is great, and then, 34 individual users like went in, clicked on the thing to get to the page and the assessment, so. But the good news is, of those 34, there are actually 95 clicks, which means the people that are engaged went back again, so.
Great, thank you.
Yep.
Okay. So let me make sure we have our technology together. All right. Hey, you all can see this Excel document, correct? And we've seen this before. So this is an example. This is not what it will look like. You will see something much more user-friendly, but this is to demonstrate how this tool works. We had a lot of conversation in the steering committee. You'll see the yellow boxes are ways that we've changed this tool. I'll want your feedback on those changes because the steering committee wants your feedback on those changes. But here's the idea. In this example, we're going to use built environment, which is one of our social determinant categories. And it asks you to score each intervention using the scale below. 1 being very unlikely to 5 being likely. Okay? These are just 4 different ideas. One of which, the circulator, I'm sort of trolling Dave Boss on this because, you know, I like to use the circulator as my example in a lot of intervention ideas. These are the values that we established. I did not receive any alternatives, so they're a set. The values that we're going to use to evaluate an intervention idea. Impact on outcomes, promotes equity, complementary, investment, leadership capacity, immediacy, and stakeholder support. So your job is going to be to use those and determine out of the thing that's being suggested on a 1 to 5 scale, how much matches that definition. I'll talk about the definitions and what changed here in a moment. But for example, impact on outcomes, the question you have to answer is, does adding protected bike lanes improve the health of Lakewood community? Now, in other words, the health of the Lakewood community will be improved by adding protected lanes. Will this address disparities? Again, you'll see here there are percentages. This is what the survey that will go out this month will be about. You're going to assign your individual perspective on how much weight should be behind that value. So for example, if you do not feel like investment or money is an object that we should care about, you can put 0. That's okay. If you want to evenly divide this, you can do that. If you feel impact on outcomes is the most important, you can do that. The survey will collect everybody's feedback and perspectives on what matters most, and then democratically achieve an average weight. So these weights that I have here are just examples, and I'm going to show you what happens when you change those weights. So using this example, you can see that high to low, these are the 4 different interventions that are suggested, right? Adding protected bike lanes, bringing back the circulator, safe routes to schools, a tax credit for households going carless. Each one of these, the score is a total of 26. So these are all scored the same, but you can see the final score changes based off of the weight. And the weights all have to add up to 100%. So when we send out the survey, you won't have the ability to finish the survey unless your weights add up to 100%. Okay? So the math will work in the background, and it will also look a lot friendlier than this. It won't be hard to fill out, should only take you a minute. Here's what happens when you change certain things. Let's say, for example, that stakeholder support after collecting everybody's feedback goes down to 5%. And instead investment goes to 30%. You can see then the scores changed on that right-hand column, okay? So if I go back, pay attention to this right-hand side. This goes to 5%. You shift this to 30%, you can see how the priorities change. So our task here is to get the collective best thinking of the advisory group and the steering committee as it evaluates community ideas around different interventions tied to our main social determinant categories. So when you fill out the survey this month, your job is to tell us the percentage weight you feel like are needed for each of these areas. Okay? Then, after we collect interventions from the charrettes, we will have a list here, and you'll go 1 to 5. Well, I think adding protected lanes is a 5, and I think promoting equity is a 4, and you'll just fill it out individually. We will then average those. Add it to the weights, and that will create the action plan. It's a lot of detail. I know it's very process heavy, but our task here was to try to create something that was democratically achieved, that provides equal voice to everybody involved in this effort. That's what the ask was. And to give a sense of what the priorities should be while also incorporating community input. So, again, this is just an example. Any questions about this? Anyone confused about like how this works or wants to see anything different about how a tool like this matrix would work?
I have a question. This is Jessica.
Yeah.
So when we start scoring them and then recommend if the city will be taking the lead on it or whatever, do you want us to specifically comment the department or the service partnership or anything like that?
Yeah, so that's a great question, Jessica. I'm glad you brought it up. The areas in yellow are things that the steering committee suggested some changes around. One thing that was suggested that I think is a good one to suggest is a comment field for each area. So that, let's say protected lanes comes up and there's a particular partner, or you have some insight, oh, I know these people are working on this, or here's a grant application that I'm already working on with this, or know who's interested. You can add that sort of information. So we're going to enable all of you to have comment fields for each of the interventions, so you can add your thoughts separate from something purely mathematical. Did that answer your question?
Yes, thank you.
Great. Any other questions about how this operates and works? Okay. Cool. I was also a recommendation from the steering committee that I walk all of you through this tool one more time, because when we did it with them last week, we did not do that and they were very confused. So I'm going to assume as a result, you kind of understand how this works and the point of it and what it's supposed to do. If you have individual questions, always feel free to reach out. Okay. Now, this is where we need your feedback. There were 4 different areas where we thought it would be important to refine the definition. The first was impact on outcomes. What's in yellow is the suggested change, which is that we define the impact on outcomes as health of Lakewood community will be improved. Does anybody have any concerns or questions or recommendations about that? Okay. Second, promotes equity. We had previously listed, this will eliminate, yeah, Swagata.
I think, Lauren, just to make it really more comprehensible for all folks, maybe you want to consider defining the health, something like overall health. Otherwise, people may get confused, like, are you talking about chronic disease or mental health? So I think make it more inclusive.
I like that. Yeah, because that was something that came up. Are you talking about chronic diseases? Are you talking about behavioral health? So we're talking about just more generally. Okay, so overall health of the Lakewood community will be improved. Do we like that? Okay. Great suggestion.
Lauren, this is Trish. I wonder if we add well-being. Health still, I think many people doing this are going to talk about disease and, you know, it's more than, I like well-being better than health, or I'd like to include it maybe.
Include
Well-being.
I think well-being is, I don't know if it replaces health, but I think it broadens it even more.
I was thinking, like, we had this conversation before where
Yeah.
like health and wellness felt a little too new age, but well-being felt really nice. So I feel like that fits.
So overall health and well-being of the Lakewood community will be improved. Yeah, I like you know when you hit it because people do the smile frown face, like, yeah, you know, that's good. Okay. Promotes equity. Previously, we had this will eliminate disparities, but folks felt like that was a little too strong or promising too much. And instead, we shifted it towards this will address disparities. How do we feel about that?
I'm not crazy about it. I don't think what does address mean to most people?
It's a good question.
How about mitigate instead of reduce? Mitigate, like it's basically intervening, right? And also, I think we should probably consider defining disparities. Are we talking about health disparities, economic disparities? You know, which disparities are we talking about?
Health, economic, racial, gender, etc. Part of it is that you know, we like to leave it a little open-ended because people impose their meaning on it.
Right.
But I think maybe we do example health, economic, gender, etc.
And I think you're gonna want to be careful to not make it sound like it has to address all.
Right.
Yeah, so like an or.
So this will mitigate disparities, example, health, economic, racial, gender, etc. And I like that term mitigate. That's more active than address. I agree with you, Trish, like address is a little squishy. Okay. Smiley, frowny faces? Good, okay.
I was wondering why inequalities or inequity isn't part of that, just because it promotes equity. Just curious.
Yeah, I think the premise is that, so a couple of things. First of all, many of these were borrowed from existing efforts from other communities that are doing similar things. You know, there aren't a lot of communities engaged in this work in this way, by the way. This is sort of like a different thing, right? Old Brooklyn set a tone locally for sure. Other communities use like a similar process, and so I straight up stole from them because, you know, that's good public health. The promotes equity, I think, inherently speaks to that. Like, does this try to get after equity issues? The question is, equity means a lot of things to a lot of different people. And so the definition is to try to maybe hone in a little bit on what we mean by that term. But that being said, if you have a suggestion about better language, we would take it.
No, I think it works great. I was just very curious about the difference between the heading and the definition. So thank you.
No, thank you for bringing it up. Okay. All right. The next one, investment, and actually the next two, investment and immediacy, were a long conversation with the steering committee because we were like, well, that means a lot of things to a lot of people. And so we thought it was important to put a numerical flag in the ground to help people orient themselves in terms of what do we mean when we say significant, or what do we mean when we say quickly. So the investment piece is this will not require significant financial resources, less than 100,000. How we derived that amount was based off of feedback from both the city and philanthropy, because we were talking about it in the context of potential investments through the budget and also grant amounts that they make. What do they see as being significant? So the $100,000, initially we were talking about like $15,000. But after hearing from the philanthropic folks, they're like, no, that's not really significant to us. We can make lots of smaller grants at that level. If there are big transformational things, that threshold is closer to 6 figures. And the city essentially iterated that as well. So the thing is, though, we were asked to bring it back to you all. What do you think about that number? Do we feel like that's, for the purposes of your evaluation, does that resonate with you?
You know, I think it depends on who's taking this on, you know, who ends up with the action.
Yeah.
$100,000 might not be much to a foundation or the city, but it would be a lot to an organization our size if we had to go somewhere else for the money.
Yeah, it's a really good point. And here's the other
We're
thing.
not going to count on 2 foundations in the city of Lakewood to pay for all this stuff. I mean, hopefully whatever we come up with in the action plan fits some other foundations priorities. So, you know, we could be fishing for money in a lot of places.
Yeah. And here's the one thing that I'd like to highlight with this number and also with our process. We have that implementation rubric, right? The .mlpf form that we discussed.
Right.
Which can be adopted by multiple types of organizations and a way to evaluate how you see it. So if, Trish, for example, the community service center, you're like, we need 10,000 and 10,000 is a lot to us. There's a standard that you can borrow from to say, yeah, 10,000 didn't necessarily score high on this part of the prioritization, but look at all these other measures. We feel like we can get it done for this amount. Here's what that rubric says in terms of how we think about this issue. It might be a useful way to translate to another foundation or to, a potential partner who might just directly invest. So it's a good point, and that's why we're bringing it up. So the real question is, are you all comfortable with this 100,000, realizing that you're the ones who are going to be using this to score it, but also you can add comments to it and you can change the weight. you know, if money is the most important thing, you can make 100% everything else zero.
Right.
So. Do we feel good about that number?
Yeah, yeah, as long as we have those other factors to weigh in, it's probably fine.
I have another question, sorry.
No, not at all.
When people are taking the survey, my only concern is not coming from a place of knowing what the cost of some of the things implemented is.
Yes.
Because like I'm often shocked when I just buy something for our organization, one item, and I'm like, wow, that's a hefty price. So I'm just curious about how that might skew things.
Yeah, that's a really good point. And you know, that's part of where the process is intended to help achieve a common understanding, right? So here's the thing, like, it's always sort of a joke, like in business school, like who knows here the price of a gallon of milk? Amy does, right? A lot of us do on a consumer level. Sometimes when you get beyond a certain level, or if you're so systems focused, you don't have the practical ability to see into something, or you might be separated from that process, right? So for the community service center, as they're thinking through the food delivery program, they're very sensitive to certain price inputs. What's the cost of gas? What's the cost of, you know, that gallon of milk? How does that change the benefits either we receive or that our consumers receive? How does that tie into things like additional grant dollars and the amount of money we have today versus what inflation might be doing for certain goods and services? So it's difficult. One of the reasons why we wanted to give everyone here and on the advisory committee and steering committee an equal voice is because we know that when everybody evaluates the same thing, even if they don't know specifically how much a gallon of milk is, when enough people weigh in, you tend to get pretty close. There's this statistics lesson where basically if you had a stadium filled with people and you asked everybody how much, if you put a cow in the middle of a stadium and you asked everybody how heavy do you think that cow is, that you'll get within like 1 or 2% of the actual weight based off of everybody's perspective. So there's an inherent bias correction with democracy, but also this is where the weights come in. If you're evaluating things and you're like, you know, the money isn't as important to me as, say, the impact it has on equity or the impact it has on outcomes, or the fact that the community has resources for this already through leadership, you have the ability to devalue one versus another. And our hope is that by relying on that system and trusting democracy, essentially, that we get to the best possible prioritization. At the end of the day, maybe you don't know what the price is for XYZ activity. But then if it does squarely fit within, let's say, the city of Lakewood's purview, they'll have that implementation rubric to go through and say, yeah, you know, protected lanes were #1 on built environment. But when we looked at it, it's going to be $10-15 million to get done because that's the engineering expenses. And then that also changes or pivots how you work on that policy and communicate back out to the community and why we want a regular group to meet. Because if it does cost that expense, well, is this something that the community would want to fund? Is it something that should pool resources from multiple foundations and the Department of Transportation? So then that way, there's a more regular engagement process so people understand it, can contemplate it, and feel like they're participating. I know that's a very long answer to that pretty simple question, but the idea is basically like, you don't have to be an expert in all of these areas. We're just relying on your expertise to be a part of the larger expertise of everybody's lived and professional experiences to be meaningful in a representative fashion.
Thank you, that's really helpful.
Okay, so I feel like the number is okay. We're good with the number. Okay. The last area definition of commenting is this can be implemented quickly. Quickly means a lot of things to a lot of people. Now, realizing again, we talked with the steering committee, right, funders in the city. 18 months seemed reasonable because of timelines associated with public budgeting, right? The city's going through a budget right now. So, to prepare for something that might require a budget request might take time. Similarly, with grant requests, there are grant cycles. And those grant cycles can happen within a few months, can happen much longer. So 18 months seemed reasonable relative to like some longer form stuff, right? To do something like adding protected bike lanes might be multiple years. I'm sure, Dave already has like nightmares about scooters and the planning that went into it and the planning that continues to go into it, right? Before it becomes a cultural norm of how people might get around Lakewood. So similarly, we're trying to also accommodate how long these things can take to implement and institutionalize if they're really complicated. So quickly was something that, we wanted to be able to provide a weight around, but also try to give a flagpole around what do we mean when we say quickly. So how do we feel about the number of 18 months? And I know in COVID, time is a flat circle. So, that's okay too, but.
Hey, Lauren, this is Jessica. So just a question, might be a little stupid, but why not say this can be, I don't know about the word quickly. I'm still on the fence about that, but why don't we own it and just say this can be implemented realistically within 18 months? Or whatever number we choose.
I think that definitely creates a sense of operationalizing something versus perceptions of operationalizing something, which I like. I like that change, but I'm not the one. I'm not king, right? So how do other folks feel? Do we feel like that's a good suggestion?
Well, before that, this goes back to that investment question about, material costs is not just material costs, but when are they available, stuff like that, or when can people start implementing things and stuff like that. So if we can say this can be implemented realistically, then we can go back to what's going on currently in the economy and get materials and stuff like that. So that's the point. That's where I'm coming at it.
I like that change. Yeah, and I think that makes sense. It also, like you're saying, refines how we think of the other pieces. Great. Other comments, thoughts?
Lauren, when you were talking before, you said something can be implemented or institutionalized. Do you think of those two words as the same?
I don't. Which is why, starting something, I tend to see implementation as like all your ducks in a row and then you're starting work. Institutionalized means like it's there. It's, we've achieved.
Okay, I just wondered what the steering committee thinks implemented means. Getting started?
Yeah, that's a good question. So realistically, this project can be started or initiated.
Yeah, I mean, because I think implemented means something real, can be a confusing word.
Okay. So this could be initiated realistically within 18 months.
I might make the time shorter. I don't know. I mean, finishing it in 18 months, maybe. I don't know if we want to be that patient to get started in a year and a half. Don't know.
Other thoughts? I also, trying to be a grammar nerd, might want to do realistically initiated.
I still put 2 spaces after a period at the end of a sentence, so talk about nerd.
I love teachers who accepted that when I was in school because I was like, yes, I get an extra line or two, but. Nice copy. So I think that I'd like to keep the 18 months, at least for now, because of the feedback from the institutional partners who put on the timelines of budgets and grant cycles.
Right.
But that doesn't mean that you can't comment or say this can happen much sooner, or to add value or to take away value from the weight that you have personally. So I want to highlight those 2 things. You still have input on it.
Yep.
Okay. Any other thoughts there?
I think it's also usually best to under promise and over deliver. So really good expectations that are easily deliverables, I think is probably a better approach. So I think the verbiage is really good on this one.
Okay. I got frowny face, smiley face vibes. So I think we're good on definitions. The last piece on this, a couple of things, is that we'll add comment fields for each intervention. So you'll be able to weigh in on an intervention. You can say, this is a terrible idea. You can say, oh, I know someone's working on that. You can say, oh, this aligns perfectly with the Tiger Grant application I saw. Whatever information you would like to add to contextualize how you're scoring something or what you think is important for everybody to know, we'll collect that. It will also be anonymous, unless you say, I'm Alex from Lakewood Live. This is exactly what I think. But we'd like to keep the comments as contextual and informational for the purposes of the plan, right? So we'll keep those comment fields in. The last thing is and this was a suggestion of the steering committee. As great and fantastic as I think the CCS team feels like it's doing, this is not the only thing that all of you do for a living, participating in a voluntary advisory committee. So it makes sense that the conversation we have here today, even though this is being recorded and will be posted on our site, that you may need some refreshers about why we're doing this and how to do it, if that's a fair comment to make. So we're also going to add some instructions and a preamble about what this is. And I just want to highlight again that we're centering each of your voices with equal weight. So this is about offering your perspective on how you feel and think about different ideas. And so if Amy and Leslie are evaluating the circulator, and Amy is very supportive and Leslie's like, I don't think it's the most important thing, both of those things, both of those perspectives will be represented. So we are intentionally forsaking individual voices over a collective voice. At the same time, you will have influence through the comment process and through the weighting process to influence this, and we'll just reiterate that in our narrative to you. So that's the last piece to highlight. Any other questions about this tool or about why we're doing it this way, or any just thoughts, perspectives on it generally? Great. Okay. So to confirm, October, we will send you a survey so that you will weight each area, each value, and you'll have the ability to see that weight averaged for when you actually evaluate interventions. So we'll send out a survey, all of you will participate, and you'll be able to weight these values, these 7 areas. The last week of October, our virtual charrette will be a week long. That virtual charrette will include promotional materials and an instruction video on how to fill it out. We will need your help in promoting all of that information to the community. So when you get that link to the virtual charrette, when you want to put it on social, when you're in your newsletter, please send that information out. Patty and Ebony are going to pull that information together. It will be very intuitive. Has anyone ever heard of Padlet? I'm sure Lakewood Schools has. It's Padlet based. So to Emily Matilla, our research director's point, she's like, my second grader figured out how to use Padlet. I think we can use it pretty successfully. And here's how it will look. It will have each of the categories: built environment, healthcare access and equity, that sort of stuff. The interventions will be listed. People can add ideas, and you can upvote or downvote ideas. So if the circulator comes up and Dave just gives a big old thumbs down, I'm just kidding, Dave, sorry. But you can upvote or downvote other people's ideas. We also will have moderation, so you won't see profanity, and we'll be able to kick people out who might post things that are inappropriate. Okay? We will try not to moderate too much, only when it's obviously offensive or not in the spirit of the project. And again, an instructional video will be part of that. Last week of October. On October 27th, we'll have an in-person version. The in-person version will have staff from CCX. There will be poster boards for each of those same categories that will kind of resemble what we're trying to do with the Padlet. It will have intervention ideas that are already there, that came from the assessment or other places. And people will have Post-its where they can offer their own ideas. And they'll have green stickers and red stickers. Green stickers, this is a good idea. Red stickers, I don't like this idea. And then that way we'll get a sense of generally that where the community is on various interventions. We'll collect all that information, collate it, and then there will be a second survey for all of you in November, where you will evaluate and use the matrix tool to actually score the interventions. Then we'll collect all that information, pull it together in an action plan, and that's the end of the project. I will say this. In addition to the evaluation of intervention ideas, we are likely going to have two main recommendations. One main recommendation will be that there needs to be regular centralized communication on issues related to community services around health and well-being. Because one thing that we found is a lot of people had a lot of different information sources about where to go for things and how to address them. The second recommendation we're going to make is to institutionalize the advisory committee in some form to manage and take ownership over this process. The last thing you want is to have sat on this many Zoom calls with me and have it lead to nothing. That would be, I don't believe in that sort of torture, okay, or any torture really, but I want this to be meaningful to the community and to all of you and to all the energy that many community members put into this. So we want to have some sort of entity responsible for executing on this, okay? And that will be it. And then that will round out 2022. And then hopefully that means you can hit the ground running in 23. Does anyone have any questions about that timeline, about the steps, about the expectations for all of you? Any general questions or feedback about our process or where we are today? Okay. I'm feeling good. I think this is going to be fun. So another thing is, as advisory committee members, you are not prohibited from offering intervention ideas. Okay, so if you want to participate, in the charrettes, feel free, but also encourage other people to do so. the ideas are only gonna be as good as the people that offer them. So when we get to promotion time, please, please, please send it out through your networks. All right? I think that's it. So I think we're good for today. This time next month, the charrettes will be over. Or, no, not quite. They'll be, it will be in the middle of the charrettes by this time next month. So you'll see email communication from us. You'll see a survey from us. If there's anything you need in the interim, let us know. Then in November, we'll do the scoring. Then December, that's it. So we only have 3 more meetings after this, at least in terms of this part of the project. Okay? All right. If you need anything, you know where to find us. Thank you for your time and your energy and your effort so far. If you haven't, feel free to check out the links that I put in the email earlier back to City Council and the Cleveland.com article covering this event. We've also talked to the Sound of Ideas potentially about featuring this project. So I may come back to all of you with a request for maybe one of you, a community member in particular, or someone who participated in this process to participate in that. But we're working it out, so still a lot to be determined. But thanks for your time. Have a good rest of your afternoon. Let me know if there's anything else you need.
Thank you.
Thanks.
All right.